Hello, everyone. We have with us today Dr. Heidi Murley from St. Elizabeth Physicians and a general surgeon who is the expert, or one of the many experts at St. Elizabeth, who is dealing with the effects of the COVID pandemic. And so, Doctor, just want to, a couple of items to talk with you about, especially that I've been getting questions about, are those who maybe have just gotten the ability to come back for surgery. It's been delayed. You had a number of weeks that you could not perform surgery, correct? And maybe you could walk us through now the fact that you can do this and the ways that you're protecting your patients to make sure they can do that safely.
Absolutely, happy to speak to that. So in mid-March, we stopped doing any elective procedures. We've been continuing to do all the urgent and emergent things that our community needs. But we've been phasing back in as recommended by the Kentucky Hospital Association and the governor. And today actually starts phase 4. So we are fully open for business at this point. Things that we're doing to keep that surgery experience safe for our patients, for their family members, and for all of our staff, we're masking all of our patients that come into the hospital. We're wearing masks all the time for every interaction. Any visitors that come to the hospital are also screened for temperature. We're all being screened when we come in, make sure no one has a fever. Everyone's wearing a mask. We're doing additional sanitization and cleaning procedures around all of our equipment to make sure that things are safe. We're doing social distancing. We're limiting some of the visitors to the facility to try to clear out some of those waiting rooms so people are able to not be sitting in close proximity to others. All of those things will significantly decrease risk. The other thing we're doing for all of our procedures is pre-testing patients to make sure that they don't have an undiagnosed COVID-19 infection before they come in for an operation. That helps us detect any asymptomatic patients that might be unknowingly coming into the hospital with an infection. It's important for patients because then they don't have to worry about blossoming an infection when they're trying to recover from surgery. It also helps us protect our staff and others in the community. So that's an important piece.
So if there are situations where we have those who in our family, there are situations we have in our family where maybe someone's a little bit older and they're in the population that would be potentially a little more at risk, and they're asking advice, well, should I hold off the surgery? What would you recommend there?
At this point, we are fully open and we are safe. We're doing all of these additional things to ensure that we're not creating an environment where patients are going to get an infection from the hospital. When we're wearing masks and patients are wearing masks and family members are wearing masks, then the risk of transmission is very low. And testing to make actively carrying virus at the time that they come in for procedures is very important.
So if someone is being tested today and they're asymptomatic, is that an issue to you at all that in terms of affecting other patients that are in the hospital?
We think that with our social distancing, our good hand hygiene, our cleaning of surfaces and masking everyone, the risk of transmission, even if there's someone who's asymptomatic and not yet diagnosed, is very low.
That's great. And you guys are using some of the best protocols across hospitals in the country that I've been told. So that's fantastic. Let's talk about testing for a moment. So Sandy's been a huge partner in the drive-through testing that's been up for a couple of weeks, and now it's into its third week. Maybe you could tell us a little bit about that and the things you've seen and want to share with the public.
Yeah, absolutely. So a lot of community members want to be tested. They want to know if they could be harboring this virus. And the drive-through testing is open for all Kentucky residents. You call to make an appointment and then you come through, and this is done as a PCR test, which is looking for actual virus particles. It's done as a nasal or nasopharyngeal swab, and it's done right in your car. So we are actually having a first responder day next week on June 5th, where we're testing all of our first responders who are interested in calling and making an appointment. But anyone in the community throughout this week and next week on our weekdays can call and make an appointment.
And one thing I've noticed is that we've had some rainy days and people have reserved a spot and maybe chosen not to show up. But that can be done even when you're in your car, right? So you don't have to get out, you don't have to deal with the weather, you can still get your test done. And that is free, correct?
Yes, and we do have spots open for this week and next week. So call if you're interested in testing.
No matter what age, is there a limitation?
There's not an age limit.
Fantastic. So talk about a little bit about the takeaways. I've had also some individuals who've not necessarily needed a surgery, but there have been some stories around the country about those holding off procedures, and then potentially missing care that they otherwise should get. And I think you'd probably feel like this. Doesn't matter where you're going, you need to make sure you get the care that you or your loved one needs and not wait, I think is the message that I've heard.
That's absolutely true. So we don't want people to have symptoms of heart disease, of high blood pressure, having a stroke, and not be able to come to the hospital because they're afraid of COVID. We really are a place that is safe and clean and ready to take care of any urgency that arises. We also want to make sure that people feel comfortable to come in for screening. That's how we detect breast cancer early. It's how we detect colon cancer early. Those screening tests, particularly for cancer, are really essential to make sure that people aren't diagnosed later in the process of the disease. So we want everyone to come in for the health care that they need.
That's great. Well, the testing you've been doing for weeks and really months now, and ramping this up, has been able to kind of test the community and get the data back that shows you're able to present this level of service in this manner, keeping everybody safe, which is really, again, fantastic. Is there any other takeaway that you'd like to share with the public about what's going on with St. Elizabeth, and in terms of making sure that we're also trying to get back to some semblance of normal in terms of visitation or anything like that?
Yeah, I would say that things are going to look just a little bit different for the foreseeable future, meaning masks and temperature screenings and limited visitation. But other than that, we really want to fully engage with our community for all types of healthcare, whether it's urgent or completely elective. So at this point, we want to encourage everyone who needs to come in or is just due for some routine screening and follow-up healthcare. Come on in, we're safe, we're right here.
Fantastic. And we're going to post the number here below us that makes sure that people can call in the 800 number, get registered, and hopefully get that testing to make them feel a little bit more comfortable with where they are.
Absolutely.
Thanks so much, Doctor, for everything you're doing.
Thank you for having me.